But just like many companies in Kern, Hall is not immune to the economic challenges facing this country. So back in April, the company of more than 450 employees applied for and received a federal Paycheck Protection Program loan of between $5 to $10 million. The exact amount was not released.
The PPP allowed Hall Ambulance to keep 100% of our workforce employed. We're talking about paramedics, EMTs, emergency medical dispatchers, support staff, everybody on the Hall Ambulance team.
Funded by Congress, PPP funding provides forgivable loans to small businesses to help them stay afloat.
The PPP helped Hall Ambulance bridge a gap created by the COVID-19 and the stay-at-home orders. And without that money, we would have had to lay people off. And in the end, we haven't had to do that.
Another PPP recipient, Bakersfield Heart Hospital. It too received a loan of $5 to $10 million, a sum of money given to at least 5 other area businesses. In fact, this list from the Small Business Administration shows at least 500 local businesses that we know of received a loan of at least $150,000. The SBA did not reveal the specific totals of each loan, but it did provide names, including Bill Wright Incorporated, Good Samaritan Hospital, Varner Brothers Incorporated, and Kingston Healthcare LLC, just to name a few. Back at Hall, as the ambulance company prepares to celebrate 50 years of service this February, they're looking towards a bright future.
Whether it's a pandemic, a natural disaster, a man-made disaster, Hall Ambulance always anticipates being there to answer the call.
A call that continues to be answered, thanks in part to PPP. In downtown Bakersfield, Eitan Wallace, 17 News.
And now to the latest COVID-19 cases in Kern County. Public Health reporting 174 new COVID-19 cases, along with 2 deaths this morning. That pushes the number of positive tests to more than 5,500. 84 people have died from the virus in Kern County since early March. More than 1,500 people are currently infected, with most recovering at home. 125 people are hospitalized. According to the state, there are 60 intensive care unit patients and 85 ICU beds still available. Projections by Kern Public Health say we could surpass ICU capacity later this month, but there are plans to increase that capacity in case of a surge in cases.
Meantime, at least 10 California counties are now actively enforcing the governor's mid-June order to wear face masks in public. Kern County is not one of those counties, and the number of local COVID-19 cases continues to rise. 17's Robert Price has more.
It was nearly a month ago that Governor Gavin Newsom issued a mandate requiring that all Californians wear a mask in most public settings. If you've been inside a Kern County store recently, you know how that's going.
Kern County Public Health largely has taken a hands-off approach to enforcement, opting instead for an educate and encourage approach. Public Health Director Matt Constantine says that's because he views this as a state enforcement issue.
Well, first off, it's important to recognize the governor did this, right? The governor put out not only his order mandating masks with the state health officer, but also then put out some strong guidance documents. So this is required now. There's been some interest on how best to educate and bring awareness to the importance. And I'm assuming the state will play a role in that. But that has been asked of our community by the state now.
Governor Newsom has formed a multi-agency strike team to go after violators, and individual agencies are also active in enforcement. For now, several state agencies are playing the heavies, sending teams of enforcement officers into counties throughout the state. Among them are Alcohol Beverage Control, which visited 81 Kern County bars and restaurants over the long 4th of July weekend and issued 2 citations. ABC did not identify those bars or give details on their fines. Another agency conducting checks is the State Occupational Safety Administration, Cal OSHA, which supervises the health and welfare of workers. In this case, whether employers are taking proper precautions against COVID-19. A Cal OSHA spokeswoman said the agency made an even 100 compliance visits in Kern County over the same weekend. With COVID-19 numbers increasing throughout the state, alarmingly so in many cities, what might Kern County Public Health be asked to do? Constantine awaits word.
I emailed and asked if we could talk more specifically about, how do you set your priorities and where are you going to focus on, and is there some ability for the county or the community to provide input? So we're hopeful to have some discussion.
So don't be looking for the sheriff's mask patrol to be knocking on the door of your business anytime soon. But people from state agencies, that's another matter. In Bakersfield, Robert Price, 17 News.
That takes us to tonight's 17 interactive feedback poll. We've been asking, should local businesses enforce the wearing of masks among their patrons? Here's how the votes break down so far. 74% of you agree with that. 26% of you do not. Here is one of the comments we received tonight. Dana Lauk says, yes, I have to wear one at work. The customers have to for everyone's safety. And Cindy Larson says, no, not if the customer doesn't want to wear it. I think it should be a personal choice to wear one and not up to the government. Besides, they never mandate anything during the flu season, so why now? Still